You wanted the best. You've got the best podcast. The hottest podcast in the world. The Chris Voss Show, the preeminent podcast with guests so smart you may experience serious brain bleed. The CEOs, authors, thought leaders, visionaries, and motivators. Get ready. Strap yourself in. Keep your hands, arms, and legs inside the vehicle at all times, because you're about to go on a monster education roller coaster with your brain. Now, here's your host, Chris Voss.
Okay, folks, so we're here today at South by Southwest 2023. We're interviewing a lot of different booths that are down in South by Southwest and seeing what they're doing there, how they're doing it, and bringing you some of the most important, innovative products and services that are out there in the marketplace. Today, we're talking with Lasso Health, and they're exhibiting at South by Southwest in booth number 1435 in the Creative Series Expo portion of their show. And so we're talking today with the founder, and we're going to be interviewing him on what their app does, how they do it, and everything else. Today we have Hamed Mizani. He's the founder and physician of Lasso Health. Welcome to the show, Hamed. How are you?
Thank you. Doing very well. Thank you, Chris.
There you go. Welcome to the show. And give us your .com where people can find you on the interwebs as we get into what you do.
So, lassohealth.com. I'm a practicing physician, and over the past 25 years in San Antonio, Texas, kidney specialist, seeing all kinds of patients with severe illnesses, in the hospitals, ICUs, and emergency rooms. And over time, realized that what I can do as a physician really applies to one patient at a time. Mm-hmm. And if I can create a system where the benefit reaches millions, then that's actually much more effective. So looking at what we have going on currently in our healthcare system is that the majority of people don't have access, and those that have even insurance, health insurance, don't know how to use it, with large deductibles and significant red tapes. But similarly, doctors on the other side, there's such a high overhead of operation that they're going extinct. And many of them are joining hospitals or even insurance companies. And what's missed here in the middle is the patient. How do patients navigate and survive, So Lasso Health wants and is going to change that.
Mm-hmm. And what is the catalyst that you're using to make that happen?
So we've started the product on a sort of, think of it, a triangle. On top sits a telehealth services, which is nationwide program, and it's membership based. And best comparison is Netflix. You pay a monthly membership, you watch as many movies you want, and you don't pay for those movies. Oh, wow. Similarly, here you pay for an individual $16.99 a month membership, and you can see as many times as you want your appointed primary care physician, or actually access urgent care services within 20 minutes of activating that 24/7. Wow. You will have somebody call you back. And remember, one of the most important things is mental health in our country. That is also in there. So, being able to talk to a counselor, teen therapy is one of the products within that package. So here, just sitting at home, you can have access to all of that with a very low monthly membership. Of course, the take here has to be mass use of this so that we can create another healthcare system, right? So that sits on top of the triangle. On the bottom left, we got also prescription cards, membership based, that once you get that nationwide, you can have up to 80% discount on your medicines, even without insurance. That's the key. Think of removing insurance from this, right? Wow. And on the bottom right of that triangle, then you have in-person visits. So anytime you need to see a doctor, that is fee for service. So, docs, they have their own portal in their office. They sign up on Lasso, become a sort of a provider. And there they can create appointments for patients to access, discounted prices, but that is a la carte payment. And this way, what we've created is price transparency. Because, Chris, if I ask you right now, okay, let me ask you a question. If you want to do an MRI, do you know what it costs?
I don't know what it costs, but trying to find out the cost is nearly impossible, it seems.
It is impossible by design. And, we won't get into that. But why is it that everything else that we buy has clear access, clarity, and price, and healthcare doesn't?
Mm-hmm.
We want to change that. And we need the mass of people actually get on the app, check it out. Mm-hmm. Actually, April, we have a month free for the telehealth services component membership on top. Try it out and see how it works. And our Lasso Health also partners with Walmart Virtual Health. So it's really trying to change the way we see healthcare.
So that's very interesting.
Yeah. I mean, I was talking to another guy earlier doing another podcast, and the guy walked me through it, and he said, "Hey, I got abdominal pain. What do I do now?" And he walked through what he would have done now, mm-hmm. and what he would do having Lasso. It was very interesting.
Yeah, I was featured in Forbes about, I think in 2012, 2011, and I'd had a really bad experience with a doctor who'd almost killed me because of his resistance for giving me a penicillin and then trying to get referral money for referring me to the hospital for a bone scrape. And turns out I just needed better penicillin. And he almost created a condition where I would need a bone scrape. And the nightmare of going into, setting an appointment 2 weeks out to see an ailment I'm having, sitting in a doctor's office for 2 to 3 hours, and different things. I said there needs to be, telemedicine that needs to come out. Why can't I just call or have a webcam conversation with people? And since then, companies like yours have been created to do telehealth. And I think this is really important for people to have because they can have immediate access to telehealth where it seems like a lot of doctors' offices are set up to kind of make it really hard for you to get through to them. You have a thing you're announcing with a collaboration with Walmart Health Virtual Care. Tell us a little bit about that and how that's working.
Yeah. So, in our discussion throughout this whole process, Walmart Health approached us and said, we want to work with you guys and basically work on pricing, packaging this in a way that is accessible for majority of American, right, population. And so the platform of telehealth is entirely working with them through our systems. And I mean, every doctor that you'll see on that app, they're licensed in their state that they're operating, right? Similarly, the counselors for the mental health, they're licensed in their state. And then here's a point about your experience, right? So you called around, waited, went to see the doctor, waited in the reception office. Here, you don't have any of that. And guess what? Let's say you choose a primary doctor on the telehealth service platform and you talk to that person. You don't like that doctor for some reason. Well, you can change him. You can change him because it costs you nothing, Chris.
Oh, wow.
It's $0 per visit, right? So you made an appointment, you talked, and, I kind of, as a doc, I say this all the time. There are patients that don't click with a particular doctor, and there are others that do. We're human. You can find the one that you like, but you can do it at your convenience, and there is not additional fees that you have to pay. So, Chris, we really learned this in COVID. So COVID was very bad, killed a lot of people in the world and here in the U.S. But it taught us a different way of practicing medicine, right? So almost depending on the specialty of the doc or who you're going to see, up to 80% of the visits could be done via telehealth, right? This is for outpatient care, obviously not hospital, right? If you need to have a surgery or you need to have blood draws or dialysis or, ICU care, obviously, you have to be in the hospital. But we're talking about outpatient care. And what happens is many times people don't do it on time. They wait, and things get worse. A mild infection turns into osteomyelitis or infection of the bone. Then it's too late, right? So I think we can remove care deferment. We can take the scary out of healthcare expense because the price is transparent. We can take away the lack of access, no matter where you live, in a city, in a small town. As long as you have internet and a phone, you're 20 minutes away from talking to a doc. So this way, potentially, this service can create a little platform nationally for everyone, because almost everyone can afford $17 a month, to have this coverage. But thinking even bigger than this, businesses, right? Little mom and pop shop, they got 5 employees, they don't have health insurance. Well, try it out. You'll have something. With this, I am not saying that we need to abolish health insurance or not have health insurance. What I'm saying is that initial deductible that people always have to pay out of pocket, right? $3,000, $8,000 family, which is rising constantly. It could be addressed this way, with a very, very low amount monthly membership, which is you can cancel anytime if you don't like it.
Yeah, it's I love the telehealth medicine. Now, some of the features of this are pretty interesting because you have it where it's basically a subscription model, really, when it comes down to it, right?
Right.
Yeah. So basically, for at less than $1 per day for the PR thing here, medical providers nationwide are available as needed. There's no restrictions in the number of appointments a patient can set, and it's not health insurance, so there's no copays, no surprise bills, and no limits. That's the thing that I always hate about when I work with doctors is I don't want 50 million surprise bills from, wait, there was a guy who walked in my room for 5 seconds and we're paying him $2,000 to look at me for a second or something. I don't know what happened, but I got a bill for it now.
Yeah. So, doctors, practices have an incredible overhead and expense in operation. So, whatever you pay that doctor, is not going to his pocket. He's really trying to operate a number of staff that have to deal and fight with the insurance company to pay for the visit, right? And oftentimes we take care of up to 30% unfunded patients that there are services that are provided that you got up 2 a.m, you went and saw that patient and came home, that you will never get reimbursed. So doctors are under tremendous amount of stress as well. There's lack of staffing. There's lack of nursing. There is a higher cost of operation, and yet the reimbursement is the same, is unchanged, right? So we want to challenge, we want to fix that as well. It's almost like a different healthcare system, and it's driven by price transparency, access. Everyone in there knows what things cost, and the patient chooses to who they want to see. You see what I mean? But it begins with a simple virtual platform for visits, which is membership based. And again, I mean, the best comparison I can make to it is Netflix, right? I mean, when it came out, people were like, well, how come? Well, they're streaming movies. We actually have a trademark on streaming healthcare because we want to get there and change the paradigm.
And this is a great thing to have. So you've developed an app, and so people can do all of this through the app. Is the app in the App Store currently?
Yes. So it's in Apple and Google Android platform, but it's also on website, desktop website. You can access this and work on it. We, Chris, we're also very interested in talking to large employers, right? Okay. Thousands of people that have their own health insurance, right? But give us an opportunity and we can show you return on investment and lower your healthcare expenditure as an employer, right? So the premium for health insurances are rising tremendously every year. And so does the out of pocket that the employees have to pay to keep that same insurance, right? So instead of on a Saturday or late evening having a cough, fever, you go into an urgent care center and getting hit with thousands of dollars of bills and unknown, surprise bills. Here you get on your app and you stream healthcare, right? And before you know it, you get your prescription sent to your pharmacy of choice, and case closed. As a doc, I know that just having access to doctors and nurse practitioners or PAs is not enough. You have to have prescription. They need to go get their meds, right? And that's why on the triangle that I described to you, on the bottom left, there is prescription access. So nationwide, we'll be giving, discount cards that you go to different pharmacies. We're about to launch, I'm going to announce it here actually. We're about to launch a segment of the app that you go in and you put your medicine that you're taking, generic or brand, and you will basically, based on geolocation where you are, it finds you the pharmacies closest to you and lists the prices, right? And then you choose which pharmacy you want to go. So here, not only you choose your doctor, then you choose your pharmacy, and price transparent in both ways, right? So large employers, get on the app, let us come show you what we have, and you will, in this competitive market that we are for talent, people are shopping around, employees, not just go and join a company because of salary and benefit, salary and bonus, but also benefits. Health insurance is huge.
Is one benefit to, I noticed it on the website, you have virtual primary care, virtual urgent care, virtual behavior health, discount prescriptions. I imagine one of the ways this helps employers is the sooner that their employees can get care and get taken care of for whatever their ailment is, the sooner they can be, working and not have time off. Is that correct?
100%. So if you go on Lasso Health and you enter to the employer section and you enter a number of employees that you have, their hourly rate average, there is a formula that we've come up with that will calculate all of the things that you mentioned. So the lost days, in your labor force, all of that gets calculated, and you'll see in a predictive way how much you're saving and making your employees happy and making sure that them and their family are taken care of, right? Because if you have someone whose child is sick, they're not going to be thinking straight that day at work. They're going to be called in sick. But here they get access to it 24/7, and they'll be there working Monday morning. So employers are going to be playing a major role in moving this platform, even more than individual people. Because, Chris, if you reach out to decision makers and companies that have 10,000 people and they test it, right, and they like it, well, for me to reach 10,000 individual alone is very, very difficult, right? But if they start the paradigm shift, then other people hear about it, and therefore they just go and try it. Again, month of April is going to be free, so you go in there, put your email, and you get to try it.
There you go. And I love how employers can go on your website and they can calculate their savings by working with you folks. So that makes a difference as well. I really like this concept, and I think it's really coming to the future. We're seeing Walmart, of course, is working with you. I know Amazon is trying to enter this space with some prescription models or some different things they're doing. And I think this is, the insurance model has been broken for so long. And I think this is a better way where people can get more instant care. Because like I said, even with my dog, recently my dog came down with a cyst and cancer, and I needed to have her seen. We were being told a week to 2 weeks to get into her normal care doctor. And it's like, we need to see right away. Like, this is a big deal. And most people that have ailments have that same sort of issue.
Chris, my daughter is in UT Austin, college student, and in the dorm next to her, there was this young kid that jumped off the roof. and committed suicide. And I think mental health, it's something that I'm passionate about, and people having the ability to talk, right? So talk therapy and counseling is in the app, right? So you're a parent and you want to make sure your kid is at least has someone to talk to other than you, right? Because I'm a parent, and you know how the kids are. They don't listen to you, but they listen to the neighbor. You're going to have professionals that are trained and licensed in the field that they're practicing, and give them the tools so they can talk to the right person. But as you said about your dog, you know, that's one thing that in the future I would like to get into: virtual telehealth for pets.
That would be
right?
awesome.
Because, you know, a lot of times you have a dog with a rash and they got this and that, and, you know, take a picture, you upload a picture, and you talk to a vet. Why not? Right?
Yeah.
You know how much time and money that saves you.
Oh yeah. I mean, I've had issues where, you know, in not all cases you have to do things and you're just like, hey, I really need this immediately looked at, or I'm worried about this right now. And it can help people get instant answers and probably resolve an issue that might not be as big as it is. You know, I've used telehealth in the past, but some of the telehealth I've used in the past is quite expensive. You have this great subscription model that makes it very inexpensive. You know, I paid sometimes, I think, $75 to $150 for, you know, a visit with a doctor. And this is much cheaper over the long run, especially if maybe you're someone who has a condition of ailments. Well, this is pretty interesting. Anything more we need to touch on before we go out?
No, I think for people out there, just to go on lassohealth.com or to the App Store or Google, Android, and download it. And you actually can become a member and give it a try. You can cancel anytime. There's no long-term contract, and use it, right? And once you use it, you realize the value. And, you know, together we can create another platform of healthcare that doesn't include health insurance and all the red tapes and all the stuff attached to it.
There you go.
And I want to appreciate, Chris, you giving me the time to come on your show, and love listening to you. I've been following one of your followers, and is incredible.
Thank you.
Thank you for what you do.
And thank you for what you do. I mean, we need more of this. I've loved telehealth, and I appreciate it more because I've got better things to do with my time than sit in a doctor's office for 2 hours waiting for them to see me. And you know, sometimes you either don't like the doctor or whatever, and you can pick what you want. I really like this concept, and I'm glad employers are embracing it as well because I think they see the value. Thank you very much for coming on the show.
Thank you so much, Chris. Have a good day.
There you go. And to my audience, go to youtube.com/Chris Voss, goodreads.com/Chris Voss, and linkedin.com/Chris Voss. Thanks for tuning in. We'll see you next time.